Hi everybody, I'm the dental assistant tutor here, and I am doing this for some Facebook peeps on some of the dental assistant talks groups that you can find out there. Also, I am doing this for students of mine that have completed the course and are thinking of becoming a CDA. These are actual books that I have studied with, and it says that it is Dental Assistant National Board exam right there. And then the other one is the dental assistant exam. And they have CDs in the back of them and a website that you can do interactive tests with it. But for right now, for those that can't afford the books, I'm just going to go ahead and read from it. I'm not going to go through every single choice of the answer just because I don't want to make these videos that long and that boring for you. So bear with me as I do this for you. I have a clogged ear, so if I mess up on some words, I apologize ahead of time from swimming. Okay, so get a piece of paper, pencil, or just listen. You don't have to watch the video. Basically, it's going to be boring. It's studying, right? So do something while you're listening. The more you listen to it, the more you'll remember the answers, okay? When I studied for my CDA, I studied morning, noon, and night like I was studying my Bible. So anyway, here we go. Oh, and please, before we get too busy, like it and subscribe. I'm uploading so many videos to help dental assistants out there, and the likes, it helps, okay? It helps get it out there, and this is what I'm trying to do from home to help others, okay? So it will help me get some feedback, okay? And don't forget to check out my dentalindexjunior.weebly.com site. I have spent so many hours on it for dental assistants. If they're in ortho right now and they want to go back to general and they forgot some things, or if you're just starting out, I don't care if you're not my student. I want everybody who is attempting to help other people, patients, succeed in this field. And if we have great assistants, maybe we'll have less stressed doctors out there. Watch my video to change. Okay. If the dentist moves from 9 o'clock to the 11 o'clock position to improve access visibility, the dental assistant should, the answer is D, remain in the 3 o'clock position. Write that down. So, repeat. If the dentist moves from 9 o'clock to the 11 o'clock position to improve access visibility, the dental assistant should move to the 3 o'clock or remain in the 3 o'clock position. The second question they have is, it's a multiple choice. You match it. Rongiers, peristeel elevators, and bone file. They want you to know what those are. So for Rongiers, it's D. Used to remove small bone particles and bone processes after an extraction. 3 is peristeel elevator, which is used to lift and raise mucous membrane and underlying tissues covering bone. The next one's bone file, and that is B. Used to smooth a velar process to promote healing. Okay? The bone file, once you take a tooth out, sometimes it can become rough. The velar bone. So it's one of my favorite instruments. I don't know, too much texture back in my day. But you smooth it with the bone file. Okay? The next question is, it's a little bit about ortho. Okay? Match the orthodontic devices in column A with their functions in column B. So you have an arch wire. The answer is C. Directs tooth movement. The next one is 6. Ligature wire. And that is E. Ties the arch wire to teeth. Okay, that's the ligature wire. 7. Utilization of the bisect angle radiograph technique will cause image distortion in the maxillary molar region? The answer is A, true. So you'll have some true false. CD-ROM. There are also 200 multiple choice questions and 200 rationals that are featured on the additional study format, just so you know. And it has a website. Okay. Chapter 1. Chair side assisting. Applications of 4- and 6-handed dentistry techniques. The most common movements that are utilized by the operator and auxiliary, us, involved. It's all of the above for that answer. So it's movement of only the fingers, movements of the fingers and wrists, movements of the fingers, wrists, and elbow. Okay? So application of 4- and 6-handed dentistry technique includes all those. Movements of the fingers, fingers and wrists, fingers, wrists, and elbows. Heads, knees, shoulders, and toes, right? No, not that part. Okay, the function of the dental mouth mirror include absorption of the light, reflection of the light, retractions of the cheeks and lips, retraction and control of the tongue. The answer for this book was all of the above. Now, I will do the caption so you can read it and write it as we go. I do not edit the caption at the bottom when they automatically put my words on. So if they don't understand a word and it comes out to say the word, say for example, shit, I'm sorry. Alright. What are the first 2 instructions that auxiliary passes to the operator once the patient has seated, bib, position in the dental chair? It is A, the mouth mirror and explorer. The basic tray setup for all operative procedures include A, mouth mirror, explorer, cotton pliers, and cotton forceps. That's the answer for this book. A, mouth mirror, so you have to be ready. So you'll have the mouth mirror out, explorer, cotton pliers, and cotton forceps. Okay. I would throw in 2x2 gauze, but it's not in there. Anyway, when the chair side auxiliary prepares a tray setup, he or she places the instruments in order of use, just like your teacher taught you, in order of use, and always put it back in order of use. A randomly prepared tray setup presents the following problems. The answer is all of the above, so let me tell you what they are. Instruments for the procedure may be missing. Instruments need to be located. Instruments appear to be in disorder on the tray. The answer is all of the above. Repeat the question. This is number 7. A randomly prepared tray setup presents the following problems. Okay. 8. The responsibility of the expanded function dental assistant in compliance with the Board of Examiners in each respective state may include, and the answer is all of the above, so here's what it should include. Preparing the teeth for etching, placing and densing amalgam restorations, placing and finishing composite resin restorations. Okay? Now, as an orthodontic assistant, I know that we can apply etch to the teeth. But for your exam, okay, the expanded function can do the etch, place and condense amalgam, and just make it simple. Place and finish composite resin restorations, okay? If you're thinking about becoming an EFTA, I am doing a video on how to become an EFTA, and I am going to save you so much money. I am going to save you so much money. I got tired. I'm going to stay focused. Okay, that's the fibromyalgia kicking in. I get ADHD. But anyway, stay tuned, okay? See? So, number 9. Six-handed dentistry requires the utilization of chair-side assistant and a what? An auxiliary assistant, okay? So six-handed dentistry requires a chair-side assistant, and so the person that comes in to help you out, you know how we call them the floater? Well, not on your exam. It is called the auxiliary assistant, okay? During the treatment of a patient, if it is necessary to retrieve an item from a cabinet drawer, what precautionary measures should be followed to prevent cross-contamination? The answer is D, only A and B. So this is the A and B. Plastic over gloves may be worn. Sterile gauze may be utilized to open a drawer. Okay, your other choice, just so you know, a cotton glove may be worn. No. So they say a plastic over glove may be worn, or sterile gauze may be utilized to open a drawer. Only A and B is the answer. Now, I teach my assistants to use cotton pliers to go in the drawer. That's the real world. That's the real life. But never with dirty gloves, okay? So follow that. Don't even pick cotton pliers. Choose plastic over glove and sterile gauze. Those two key words for how do you go into a cabinet. Alright, got that? Here we go. The foot and backrest controls are adjusted before donning gloves. Putting gloves on. Okay? The foot and backrest controls are adjusted. Okay? Nobody does that. If you do, awesome. Okay, normally you seat the patient, you bib the patient, you talk to the patient, and, you know, everybody's putting gloves on. You wait for the doctor, and then you lean the chair back with the gloves on. So remember to wipe those buttons or put tape over the button. Okay, anyway. 12. When the operator is seated correctly, he or she should, answers all of the above, have the shoulders parallel to the floor, be seated so the knees are a little above the hip level, be able to focus at a distance of approximately 4 inches from his or her eyes to the patient's mouth. Okay, let me repeat that. Be able to focus a distance approximately 4 inches from his or her eyes to the patient's mouth. Be positioned so his or her back is straight. Yeah, keep your back straight. That's really hard to do. Remember, ask that patient to lift their chin up, okay? I have back issues today because of it. Stay focused. Anyway, remember, it's all of the above. So, when the operator is seated correctly, he or she should have parallel to the floor shoulders, be seated so the knees are a little above the hip level, be able to focus at a distance of approximately how many inches? Uno, dos, tres. Uno, dos, tres, cinco. Anyway, it's 4. Okay, trying to break out my Spanish for the Spanish viewers. Be positioned so his or her back is straight. So remember all that, okay? Question number 13 for the practice exam. When the auxiliary is seated correctly, he or she should, and the answer once again is all of above, be in a comfortable position at least 4 to 5 inches higher than the operator. 4 to 5 inches higher than the operator, the dentist, okay? Or the EFTA. Or the hygienist, okay. Or a fellow assistant, because we help each other out too. Okay, so B, adjust the stool so that the back and buttocks are supported, okay? This is not on the test, but if you want to keep your butt tight, when I was younger, I used to sit there and squeeze my butt while I was working. No one can notice. Okay, I'm trying to keep you guys awake, okay? But just squeeze your butt and then make your butt firm, okay? But that will also keep you to sit up straight. All right. Maintain his or her feet firmly on the circular platform at the base of the stool. Okay, so put your feet on that platform. That is what it's for. It keeps you from falling. Swing the arch extension from the back of the stool to prevent to the front to provide support in the abdomen. So that little thing in the back, you think, oh, I'm supposed to sit back there? No, put it around the front. Some dentists, not many, have the back support and the front. Those are awesome. I wish I could see more of those in every office for us hardworking assistants. But anyway, just know that don't straddle the chair like a stripper's pole. I've seen that as a teacher. You just put your legs in, bring that around, have your feet on the platform, and you're going to be how many inches taller than the dentist or the operator, the auxiliary? 4 to 5 inches, okay? How far away from the patient's oral cavity should the light be positioned? 12 inches. The answer is 12 inches. Remember that, 12 inches. And always check that mirror or that light, because saliva, if it was red, remember that video if you got to watch it, it has little specks of saliva on there, and patients can see that, and that's just gross. Oh, and to clean those, just so you know, buy from the Dollar Tree those microfiber towels and just use that to wipe it. 16. The lens of the operating light should be cared for by, okay, so the lens, well, I was just talking about it. So that's what we do in the field. So let's see what DANB wants you to do. Wiping it free of smudges after completion of dental procedures. Cleansing with a mild detergent and a soft cloth. Washing only when the lens is cool. And the answer is all of the above. Wiping it free of smudges after completion of dental procedures. Cleansing with a mild detergent and a soft cloth. You can't do that after every procedure, so get the microfiber cloth. Washing only when the lens is cool. Don't burn yourself, ladies or gentlemen. 17. The fourth finger rests on a tooth surface to maintain stability and enable the operator to utilize the instrument to avoid injury to the patient. The support is known as fulcrum. Remember that, fulcrum. Okay, so I got my Sprite can, and I might have had a pen out here. I don't see it, but you would have your fulcrum grip, okay? Rest your finger so you don't slip. When you're doing braces and stuff like that, rest your pinky on a tooth. It's getting warm out here. I'm sorry, I'm not in scrubs. I don't need to be. But I wanted to get some sun while I'm doing this too. So, hey, it's a win-win. And if you want to make videos, and it doesn't have to be about boring dental like I'm doing right now. I'm getting sidetracked. But check out my videos. I'm trying to help people make extra money. You can write a book. You don't have to be perfect with anything that you do, because there's always someone like you that's going to enjoy it and subscribe and like, and after so long you'll make money. So please check them out. Okay, let's focus. So that's the fourth finger, okay, for the rest on the tooth, and it's fulcrum. I'm going to give you a little hint. Double F's, okay? Fourth finger, well, 3 F's really. Fourth finger and fulcrum. Just not the middle one. Okay. The fulcrum is utilized by the operator to provide a stable point to reduce movement of the wrist and forearm during dental procedures. True. The instrument to be delivered in position blank to the instrument being returned. The instrument to be delivered to the position is parallel to the instrument being returned. A. Parallel. The auxiliary delivers and retrieves instruments with the left hand when assisting the right hand operator. Okay? So when you're assisting a right hand operator, you use your left hand. Okay? When assisting a left-handed operator, the auxiliary delivers and receives instruments with the what? Common sense. Right hand. So that's 2 questions you'll get right on the CDA exam. Woo! Okay, let's keep going, okay? When utilizing four-handed dentistry with a left-handed operator, the auxiliary should be seated at the blink o'clock position, 8 to 10 o'clock position. So the answer is B. In case you buy this book, you can just circle, but the answer is in the back too. Yeah, I don't have all this memorized now. Okay, so when utilizing four-handed dentistry with a left-handed operator, auxiliary should be seated at the 8 to 10 o'clock position. Question number 23. The exchange of instruments from the auxiliary to the operator is completed by utilizing thumb, index, and third finger. The exchange from the auxiliary to the operator is the thumb, and then the index finger, and then the third finger, okay? 24. The operator is able to convey to the auxiliary that he or she wishes to initiate an instrument transfer by maintaining a fulcrum and rotating the hand away from the patient's oral cavity. It's a true/false question, so it's true. I'm going to repeat it because it was a long one, in case you're writing this down. It's an expensive test. The operator is able to convey to the auxiliary that he or she wishes to initiate the instrument transfer by maintaining a fulcrum and rotating the hand away from the patient's cavity. Keep your eyes focused, ladies and gentlemen, on your dentist, and on the patient's mouth. Sometimes okay, let me just share a story because we gotta wake up, okay? But I used to work downtown Cleveland, Ohio. Dr. Leisman, he's probably gone now, God rest his soul. But I was, 20, and I used to go out and do karaoke. But anyway, that's besides the point. I had a hangover the next day, and it's so unprofessional. Anyway, don't do what I've done. So, and I looked out the window, and I would always see downtown parades. Woo! And he would have to go, Teresa, don't do that. So stay focused, okay? I've learned to be a great assistant with that. And when I worked for Dr. Robert Kelsel in Knoxville, Tennessee, he's an awesome dentist. If anybody needs a dentist, let him know I referred you. But I would be always catching that porcelain that comes off the crowns. So with that point being said, that sounds a little southern. I'm Yankee and southern. But anyway, focus on that, okay? Focus on that patient. So when you see the doctor goes like this, you know it's time. They're not going to say nothing. Okay. The instrument to be delivered in position to the instrument being returned is parallel. I think my page flipped. Okay, yeah, I did. Okay. 25. The oral evacuation tip is held by utilizing the modifying pin grasp and the reverse palm thumb grasp, okay? So the oral evacuation tip is held by utilizing the modified pin grasp and the reverse palm thumb grasp, okay? Wait a minute. Let me see something. Have a sip of something. Wait on me. Sorry, pause it. Well then, you pause it. That is question 25. I want to see something. Yeah, that's the answer. It gives you an explanation too, so let me read that to you. The auxiliary utilizes the modified pin grasp when suctioning during shorter dental procedures, and the reverse palm thumb grasp when suctioning for longer procedures. Okay? But there is more. Okay? You guys know that. Okay, 26. If the operator is restoring the mandibular right first molar, okay? So think about it. The dentist is fixing the lower right first molar, okay? That's his side of the chair, hopefully, for you. And the auxiliary should position the tip of the aspirator on the lingual surface of the mandibular right quadrant. Okay, so know that. Lingual surface of the mandibular right quadrant. Alright, 27. If the operator is restoring the maxillary left second molar and the auxiliary positions the high volume evacuation tip towards the what? A. Facial surface of the maxillary left second molar. Okay? So they're going to be asking you questions. Where do you place the suction tip on your CDA exam? You'll have to think, and think fast. You got more questions to go through. Don't leave any blank. Always go with your first gut. Okay, I'm focusing. Okay, 28. When working in the posterior area of the oral cavity, the auxiliary positions are high volume evacuation tip. The answer is E, only B, C, and D, and those are, okay, at the occlusal third of the tooth being prepared, parallel to the buccal or lingual surface of the tooth being prepared, one tooth distal to the tooth that is being prepared. So I'm going to repeat that question because it is a complicated one. When working in the posterior area of the oral cavity, the back of the mouth, people, the operator, the auxiliary, positions the high volume evacuation tip at the occlusal third of the tooth being prepared, parallel to the buccal or lingual surface of the tooth being prepared, one tooth distal to the tooth that is being prepared. Okay? Sometimes you do have to go before the tooth so you're not in the dentist's way. Whatever works, protect your fingers, protect the patient's lips, cheeks, and tongue, and the dentist's fingers, okay? But for the CDA exam, it is going to be occlusal third of the tooth that is being prepped, parallel to the buccal or lingual surface of that tooth, so you're not on that area, and then one surface distal, one tooth away. Okay, 29. When suctioning is required in the maxillary right molar area, the auxiliary positions the high volume evacuation to tip towards the what? A. Palatal surface of the maxillary right molars. When suctioning is required in the maxillary right molar, the auxiliary positions the high volume evacuation tip towards the palatal surface of the maxillary right molar area. 30. Which instrument is not utilized in the placement of a Class II amalgam restoration? Which instrument is not utilized in the placement? Keyword, placement, not removal. It is the spoon excavator. They give you amalgam carrier, amalgam condenser, mixture band, and retainer. We know that the spoon excavator is to remove, any cutting instruments is to remove the decay, not to place the filling, even though we still need it for that tray setup. Read those questions. Okay. 31. When placing a Class II restoration, the missing well will be replaced by the use of only B and C. So when placing a Class II restoration, the missing well will be replaced by the use of B and C, which is the wooden wedge and the matrix band. When placing a Class II restoration, that's like an MO or DO, guys, the missing wall, maybe I need to move inside because the sun's blurring me, but I kept saying, anyway, wall, yeah, missing wall will be replaced by the matrix band and the wooden wedge. Now, do you know the wooden wedge is to help prevent overhangs? Okay, I'm going to read one more, and I'm going to pause this video because I'm going to move on inside. I love the sun, and the clouds are awfully pretty today. I wish you guys can enjoy it with me, but I'm going to move inside. Anyway, the function of a hand cutting instrument in operative dentistry is all of the above. So I'm going to repeat the question again. You write it down. The function of a hand cutting instrument in operative dentistry is removing curious materials from the cavity preparation, removing decay, refining cavity preparation, so that the dentist gets in there and cleans out the decay and wants to shape the inside of that tooth. The ones that really care. Anyway, trimming excess material from the restoration. So once they place the restoration, it kind of contradicts the other one, but anyway, it's all of the above. That last question, or the one before, about the spoon excavator, which instrument is not utilized for placement of a class 2 amalgam restoration? It's spoon excavator, okay? That is a cutting instrument. But down here on question number 32, it says the function of the hand cutting instruments in upper dentistry is to, and it was the 3 choices: removing the decay, refining the prep, and trimming excess material from the restoration. So it's not placing it, but you're still kind of adjusting it. So really read those questions. Okay, I'm gonna pause this, guys. I'm gonna move on in so I'm not blind by the light. Okay, I moved back inside. All right. This is a selection organization of Armamentum. 33. Design of the handle of the hand cutting instrument is blank to give stabilization for grip and leverage to the operator. The answer is hexagon, okay? So they're asking you for the design of the handle of the hand cutting instruments. Hexagon, okay? 34. Instruments that are classified as hand cutting instruments include, the answer is D: hatchet, hoe, spoon, excavator, discoid Cleo, discoid Cleo carver, I want to say carver, gingival margin trimmer, and chisel. Okay, those are the instruments that are classified as hand cutting instruments. Hatchet, hoe. A hoe is a great source for the garden too, in case you garden. Gets weeds out great. Spoon excavator, discoid Cleo, gingival margin trimmer, and chisel. Okay, moving forward. 35. Carving instruments are classified as discoid Cleo, the Fram, the VEHE, never heard of it, but it might be on your CDA exam since it's in this book. Ward, WARD, and Hollerback. Not Hollerback girl, but a Hollenback. Okay, Hollenback looks like a composite placement instrument, but it's a little pointier and thinner to get in approximately, okay? So these are the carving instruments. Discoid Cleo carver, Fram, Vehe, Ward, and Hollenback. 36. The blank is utilized to remove curious dentin in the cavity preparation. Spoon excavator, okay? And some dentists like the small spoon, then the large spoon. Some just use one spoon, and I'm sure there's some that don't use no spoon. Anyway, 37. The blank reduces excess amalgam from the interproximal area. It is the Amalgam File. The blank reduces excessive amalgam in the proximal area. It is the Amalgam File. I have never heard of Amalgam File, but that is the answer, guys. 38. The blank handpiece is utilized to polish restoration. The contra-angle handpiece is utilized to polish the restorations. 39. A round burr is identified by the numbers, and that would be D, a half to a 9, okay? Now, I've studied for this exam. If you don't use it, you lose it. I always taught my students round burrs are from 2 to 8 because that's the most common ones dentists use. It's the ones that either are friction grip, that are smooth at the end, or it's the one with the latch looking part at the end. But that is a round burr. But they actually, not just 2 to 8, they are actually a half to 9. Okay, write that down. Which number designated as inverted cone burr? Okay, your inverted cones are 33.5 to 37. 41. The blank places pressure on undermined enamel and is utilized with a push motion. Chisel. Okay, a chisel. They gotta push it. 42. The wet-estate chisel is designed with a slight curve in the shank. So look up this instrument. WEDELSTAEDT. Chisel. And that is a slight curve in the shank. 43. The hand instrument utilized to carve occlusal surface anatomy on an amalgam restoration is, the answer is a discoid Clio carver. So when you're making anatomy into the tooth, we all should know by now that is the discoid Clio carver. Okay, so this is a matching, and the first one is 44, matrix band. Limits the filling material to confine of the tooth. Matrix band. Limits the filling material to the confines of the tooth. Gingival margin trimmer. Removes undermined enamel. Gingival margin trimmer. Removes undermined enamel. 46. Amalgam condenser. You know you can always fast forward this video if you know what amalgam condenser is. Just a little bit though, so you don't miss too much. Amalgam condenser, 46, is B. Compresses amalgam into the cavity preparation. Some dentists call it the packer. It's called an amalgam condenser. Discoid Clio carver, again, that's a big one that you're seeing a lot on this exam, is E. Shapes the amalgam restoration, which we know in another answer it was to make the anatomy into the tooth. Amalgam carrier. Places amalgam into the cavity preparation. But that's the answer in this book. But I know in school you guys were taught to help carry the amalgam to the site. Okay, so you might see carry amalgam and place into the cavity preparation. You know, that's of course a yes. But if you only see the choice places amalgam into the cavity preparation, choose that one. Next one is celluloid matrix strip, aka mylar strip. They're either blue or clear. The answer is limits the filling material to confines of the tooth. So a mylar matrix strip or a celluloid matrix strip. Celluloid must be the actual name of the strip, you know, like they name instrument. But mylar must be the name brand. But anyway, it's just